Well, you guys, thank you so much for coming today. My name is Andrea Stasyszen, and I serve as Deputy Director for the Office of Faith-Based and Community Initiatives. Our office was established, hi, and welcome. Um, has been around for actually several governors housed within the Department of Human Services. But in November, Governor Stitt relaunched the Office of Faith-Based and kind of gave a new purpose that the Office of Faith-Based works with 5 different agencies in coordination with the governor's office. And so I'll go through that and kind of introduce you to some of those. There's some really neat things that we're working on. We've brought one specific project with Delby today with Oklahoma State Department of Health that we want to share with you, but we'll also answer some general questions and kind of give you an overview. Just a little bit about myself. I've been with Department of Human Services for a decade. I am a pastor's wife. I am the proud parent of 6 children. 5 through adoption. They range from the age 6 to 25, and keep me on my toes almost every day. One of the things that I loved about this is early in my professional career, as I was teaching, my bachelor's is in education, my master's in adult learning. But I was teaching and I was also serving as a foster parent. And I realized that when families face crisis and trauma, there's sometimes a gap of what they need to do, what needs to happen, and who can actually help them get there. And so that's when I really started in my passion for community work, because I saw I'm asking her to jump the river, and I've given her no boat, no life jacket, no anything else to actually get there. How do you, my dad loves to make the joke, how do you eat an elephant? One bite at a time. And there weren't these just stair steps. So that's really what started my passion for community work, because I believe within the community, that's who needed to wrap around families and can actually make the change and the difference that we were desperate to see. Being able to integrate my faith into this as well has been great, because we know that churches make up a huge population across Oklahoma. So why wouldn't we work with people that are making a difference in their local community, have people coming to them, have programs set up that are making a difference and a positive impact. And so just getting to blend it all together. So a little bit about who I am and where I came from. Plan B. There we go. So here's a picture that we were able to take not too long ago. With the Office of Faith-Based, we liaison with 5 different state agencies. This is the Department of Corrections, Human Services, Department of Mental Health and Substance Abuse, the Office of Juvenile Affairs, and the Oklahoma State Department of Health. The Office of Faith-Based is literally 2 people. The director, Bobek, and myself. And we work with the different state agencies and they provide liaisons. We've done work all across Oklahoma and have some pretty exciting initiatives that we're working on, and some things that have happened that we're really, really proud of. Keep in mind that Governor Stitt just relaunched us in November, so we're just about to hit the 1-year mark. And so that's been pretty exciting to get things rolling and trailblazed, and just really excited with the momentum and the collaboration we've been able to see with our agencies. So at the Office of Faith-Based, we have our vision that we exist to foster meaningful relationships and collaboration among government, faith-based organizations, and community stakeholders so that they can meet the needs of citizens. Across the United States, almost every state has an Office of Faith-Based. They focus on different things. Here in Oklahoma, obviously, we have our 5 different agencies. And so that kind of helps drive our focus. But meeting with those local governments, churches, the community organizations, our nonprofits, what we really see in Oklahoma, we have a lot of amazing programming and people and organizations making huge positive impacts. And sometimes it's just a connection problem, the trying to figure out how to get people to them. Sometimes it's meeting people in Muskogee that are trying to do something, and someone's already trying to do that in Chandler, and they're doing it really well, and hooking them together. So that's why we're here, and it's been fun work. Two big initiatives, and you'll see this if you grab my business card. There's a QR on the back, and it goes straight to our website. Or we also have social media on Facebook and Instagram. So what we really try to do is connect local communities and state agencies, along with recognizing amazing work that's already been done. So we're highlighting organizations that are really making an impact. Each of our liaisons from the state agencies will send information. Andrea, here is this church that stepped up and just did this. Here is this organization that's hosting this, and this is the impact that it made in the local community. We want to recognize those voices that are making a difference, and then connecting anyone back that needs that additional assistance. We get a lot of random questions, like one that came in not too long ago. Was a gentleman, and in their small town, I want to say it was just about to be the third suicide. He's like, I need to know what's available. Yes. We were able to link up with the Department of Mental Health September, my bad. I'm already into October. My children are already trying to figure out what they're going to dress up as. I'm already trying. How did Halloween costumes get so expensive?
I know. Make them.
Yes, but that's another problem. I had to try to make Pip from Pip and Freddie, the little penguin that flies and delivers babies from Tots on Disney. Do you know how much money I spent making that stupid little costume because there were no flamingo costumes available? The child loved it, don't worry. My checking account, on the other hand. Okay, September, suicide awareness. And so there was actually programming and all of the stuff available with resources. And so I was able to hook him and his church right with the Department of Mental Health so we could have on-time connection for resources. So it's just things like that that kind of come along and can be really exciting. This is just showing I sometimes like to just stop and tell a couple of stories if you guys are okay with stories. These are some fun things that have happened within the last couple of months. They're not all fun. Like I use that word far too often. Like this lovely couple got hit with the tornado, lost like everything. They were in a rental house. It was only by the grace of God, the tree that came in actually landed on a bed in a child's room, but that child didn't happen to be sleeping in that room that night. I mean, like crazy things. And what was amazing is we were coordinating with churches and of course Office of Emergency Management and our food pantries and some larger organizations, like where are the tornado resources? Able to put it all together in one spot. And this church, it was a Hera church, came around this family, actually helped them move out, help them get clothes, help them get food, help them get set up in a new spot. And they were able, what was funny, they didn't even go to that church, but she had posted on social media, where is help available? And the social media person from that church noticed. And we had everything kind of organized and streamlined. but that church wrapping around that family was one of those things that we were able to help do. They were honored and got to go to the governor's state of the state address, um, and the Heritage Church for their work with local families. So that was really one of those really beautiful connections. This connection was pretty exciting. We had those wildfires that happened. And so we took a role in working with the churches again to kind of activate who's, it was one church is really good with food. The next church was able to handle the donations. The next church was doing good with like the clothes closet, or emergency shelter, like everybody really working together. The specific family here actually was a current foster parent and have, I believe, 4 foster children in their home at the time that it was completely destroyed. The kiddos were at school, home destroyed. And I loved interviewing her because she said they sent the kiddos with the uncle. I think they actually lived out in Muskogee, and said, guys, I need you to go here for the weekend. We're going to figure this out. Don't you worry. This is home. I'll have a plan when you come back. I was like, you talk about some statements of faith right there. Yeah. Kiddos went for the long weekend. Long story short, we were able to partner with a local church, with an organization out of Tulsa, who brought an entire truckload. These are mattresses. These are brand new shoes. These are room decorations. Somehow, we'll say by the grace of God, they on Saturday were able to find a rental home that would fit their family and the makeup that they needed. By Sunday, the truck showed up. Their church, I want to say it was 112 volunteers at different points, from dishes to beds to. So when the children arrived on Monday, they actually came home to a new home, to rooms set up that looked like their room, to brand new toys. And this tragedy, she said the kids actually thought, is it Christmas early? Like completely turned around. And that's community wrapping around and just being able to make a couple of connections. This one was when the tornadoes hit down in Ada. I was working with a local church there, H2O. And again, this person's doing this person's doing this. But did your community need anything? No, Andrea, we're good. Okay, awesome. The next day I happened to be up in Tulsa, and I got a phone call right as I was heading into a meeting. And he's like, yeah, Andrea, I lied. We really need food. I'm like, okay. One of the tornadoes hit a building that hosted 27 low-income families, completely destroyed it. And he's like, while there's bank food, he's like, right now we can't really use a big 5-pound can of beans. Like, I need peanut butter crackers, like shelf stable, ready to eat. No one has any place to cook anything. Like, we need something different. We need food. I said, okay, let me call you back. So I went into my meeting with Bridging Hunger, learning about everything that they did. They're a really cool organization out of Tulsa. Churches from all over Oklahoma come in and volunteer, and they can take food back to their local communities for their local church pantry. And so we ended up our meeting, and I said, hey, I just met with this pastor, or he had just called right before and said they needed food. I know that this is your normal model. However, is there anything you can do to help me in Ada? And he was like, okay, wait a second. And they went and had some side conversations, and he came back and he said, I'll have a truck there tomorrow. And this is the picture that my friend sent of the truck showing up to make sure those families had food. It was just a connection. The communities being strong, churches doing their church thing, just trying to highlight and recognize. This one is a free medical clinic, and they actually have a model, and they've been working in conjunction with a couple of health departments to be able to bring medical care to people that don't have medical. I loved it because with some grants that they have, they were able to have costs down. They have an on-site pharmacy. They were sharing about the things they were able to meet. And most of their patients, they only see for, he said anywhere from about 9 to 12 months. Because then once their diabetes is under control, their teeth are fixed, their whatever it is that their current health crisis. He said then they have the confidence to go get that next job, and it has health insurance. And then he's like, we're working ourselves out of a job. But I just love the model. This one was actually a church had their like Sunday school room set up as different health providers, and all the volunteers came in. And so what they were doing in a region just outside of central Oklahoma was really cool. And then this last picture that I have up here, this is Director Bobek and our liaison from Department of Corrections. We were able to host the largest volunteer training for the Department of Corrections, and Victory Church in Tulsa hosted that. This specific social media clip says 110 trained staff. There are now over 230 trained staff from that church, and they've been able to go into the Department of Corrections. Actually, yesterday was their third event. They go in with music and food and invite people out. A huge push of volunteers. I want to say yesterday there were 43 volunteers that went in, and just sharing their gospel message and giving inmates hope while they're still behind bars. So,
Which
yes,
prisons do they go to? All over the state?
all over, yes. So a couple of weeks ago, it was Mabel Bassett. Yesterday, they were over at Just Done.
Awesome.
And so it just kind of varies. I forget what the first one was.
Holdenville? Was it Holdenville?
I don't remember.
I can't think of the name in Holdenville, but it was like 600 and something, he said, 400 converts, something like that.
Mhm.
Awesome. That one really resonates with me because I'm a DLC volunteer as well. I
Okay.
worked for, actually Leo Brown hired me in 2016 to teach Spike the Character Program
Oh,
at
nice.
Northport Correctional there, and I did that for a few years until I luckily got to transfer to the Department of Health before they closed Northport Correctional and moved
Right.
everybody to Hinton. But I am a badge volunteer, so I'm trying to get some things going. So I don't really have time to do it like I want to, but that I love that because there's so much need for that inside the facilities, and I just have such a passion for it. I loved that job. I really did. It was hard.
Right. None of them are easy,
Well,
but
just
that
coming
one
to
is a
do
special kind.
that program is so awesome. I don't think they have it anymore. The Faith and Character program. It was really good. But I
In
love it.
May, I went to OBU for the inaugural graduation of our first graduating class from behind bars.
Yeah.
They actually went through a full bachelor's. We're the first in the nation to have anything like it. And upon graduation from the facility where they are, they'll actually be going out by twos to work underneath the chaplains.
Is really cool.
And it was gentlemen, I want to say with 15 years or more of a sentence, and so that they'll be behind bars, but all of a sudden they have a purpose, a vision for what future can look like.
So you work with a lot of agencies that work with the care portal.
Yes, so the care portal is more just Oklahoma Human Services because it's prevention and it's focused on children. But yes, a lot of the churches in that vein are on care
Okay.
portal.
Because that's what we do at the Evolution Foundation.
Okay.
Yeah.
Yeah, you know Doug?
Yeah, that's my partner. We work together.
Okay.
Yeah, we're consultants together through the Evolution Foundation. Doug Ishmael.
Yes.
Yeah, he's big in that.
We were working together years ago before I switched positions to get Care Portal open in Seminole.
Okay, so he was with Child Welfare for a number of years.
Yeah, that was when he was with Evolution, and then Jamie Majors, who's Department of Human Services Strategic Engagement. She was actually one of the people in the original picture. Her and Doug worked together back in his child welfare years too.
Oh, okay. All right. Yeah.
Yeah.
He's still with us. So yeah, good guy.
Can I have one question?
Absolutely.
About the location of the free medical clinic? Where's
Yes.
that?
That specific one was in Shawnee and Holdenville, but there's an entire network of free medical clinics
Okay,
across Oklahoma. And if you send me an email,
Okay.
I will
will do
find
that.
it.
Thank you.
Because they've sent it to me and they had a meeting. I was supposed to go speak at it. But then my 22-year-old was trying to graduate from college and I had to pick. And so I missed that one. But it's a really neat thing that is happening all across Oklahoma in these different models.
I'll do that. Thank you.
You're welcome. So there's 4 pillars that we focus on with the Office of Faith-Based within our agencies, and those are fatherhood, family, food security, and then foster care and adoption.
Is it the Oklahoma Charitable Clinic Association?
That one is for every clinic, the sheriff, but the other one that she's talking about is just faith-based.
Okay, that's okay. That one she's talking about, the Oklahoma Charitable.
Okay. I was like, I thought it said something about free in the name, but I don't know. I'll have to look it up. So these 4 pillars are the work that we do when we're trying to work with organizations, things that we want to see move forward. We want to see programs that are making stronger families, stronger dads, securing food, and then of course our foster care and adoption. So what we were coming here today, talk a little bit about, and then Delby's going to come and share about some of the projects we've been working on together as well, is how can we connect community partners to you, or what connections would be helpful for you? So I know you used to be with Department of Corrections and now you're with Health. I know you're with Evolution. I know you've just adopted some beautiful children.
Chronic
Health,
disease.
okay. What is it that you do that you think could be a good connection?
I'm a community engaged and liaison for Humana.
Okay.
So I'm looking for connection.
Mhm.
I do events, I go in and just help the community where needs to be helped, provide resources, help build collaborations. I go back and report to the organization what's going on in the community, what it looks like. And how, figure out ways to be supportive. So I'm looking for those, really in rural, because I'm from Wewoka. And in that area, there used to be a health department, there used to be, DHS office, nothing. And there's the homeless population has gotten a lot more. I've never seen a lot of mental health is forming, like it's more than what I'm used to seeing. Crime has gone up.
I was about to say, I have a friend there and they were talking about some gang related things happening.
Yeah, it was bad for like several months. I am working with the EOC clinics in Henrietta, with Humka and Wewoka to do health fairs. But I'm trying to see, like, if I know the DHS have like a mobile unit that they can come in, if I could find an organization where they could come in and provide.
I should have one too. I'm trying to think of,
Like, so they can come in and make appointments to set up SNAP and sooner, you know what I'm talking about?
yeah, they bring a community health worker with them. I'm trying to think of so Wewoka, what county is that?
Seminole County.
Wewoka's the Steve.
So that would be District 6.
Shawnee,
Yeah. All about it.
Before you leave, make sure I have the number and I can do it.
Okay, because I'm trying to figure out how we can better serve that community. I have worked with some churches there, where we did an NA and AA program, which they can have groups and stuff there. But like I keep talking to them, we need something, because people are not able to get out to go get
The services.
the services that
Yeah.
they need.
So at the Holdenville Health Department, that Engage Free Medical Clinic, they go up there once a month to do their free medical clinic.
Okay, that's the thing, it's a transportation.
I
issue.
know, it's what, 7 miles?
Yeah, it's 7
And
miles
a
to,
world apart?
Yeah, 7 months old.
Yeah, that's
is
what I'm
fine.
trying to see, to connect you with Brett Wood, because he's out of Shawnee, but that's his district.
Okay,
And they have mobile units, and I'll connect to see if he could maybe have the mobile unit come to
okay.
your area, would be what
Well,
we're trying.
it's not my area anymore, but it's still home. So I just was like, how can we make this better? What can we do in the schools to make the, get more support for in the schools? So I'm calling back old people. James Thrash, we made a whole, football field after him. He played for the Redskins, know him personally. Said, hey, what we need to do to get back in the community and make this better, because there's just nothing there. The one grocery store, three stop signs, it's just now becoming a retirement community because everybody's moving out, like just like houses, like a lot of people, there's no jobs. So it's going another way. So I'm trying to figure out how we can revamp it, what we need to do, who I need to talk to.
I can give you my card, the Evolution Foundation, go on our website,
Okay,
and we cover all 70 of the 77 counties. And it lists all the county coalitions there, and you can call the people that are in charge of each coalition, and they'll be able to direct you to whatever services are available in that area or closest to you, so you'll be able to see that. Just go on our website and get that.
okay. Thank you.
Okay, any other discussion here, connecting, that would be helpful?
I I am with OSDH and the Cancer Prevention Control Manager, and I have some information here about a program that we do called Take Charge. It's free breast and cervical cancer screening for people that are 185% of the federal poverty level and they don't qualify for Medicaid or Medicare. So I've got information about that and I'd love to share it with everybody.
Awesome, yeah.
And we have a coalition, cancer coalition that we're always happy to have community members join. It's called the Oklahoma Comprehensive Cancer Network. And we meet like once a month and it's virtual. So you don't have to, travel to the city or anything. And we're always looking for ways to try and help with the transportation barriers. And I've got some really good connections with ODOT and
Mhm.
their transportation managers. So
Yeah, if you guys didn't stop at the ODOT table in the vendor fair, you definitely want to do that. What they have going on with their mobility managers and their regional setup is pretty exciting. And even the connections that they've now built. So like if we talk Shawnee, they know about COTS and CATS and what the tribal one is. And if this one only does medical, but this one does this or this one does that. Just kind of a wealth of resource information when it comes to transportation issues. They've been really super awesome.
I really feel like one of the biggest barriers is how do we, let the community know what's available? No different than any other community, because they don't know. Right. Even with the new Sooner Select, like we offer rides they can set up their own rides 2 days, and ODOT will tell you this, like they can set their rides up. You can go up to 30 miles, but even if it exceeds 30, we work with ODOT and they can get it overridden where they can go further. But it's just, they don't know. So that's why we're doing health fairs and we're doing events and we're trying to stay in the community. Hey, did you know?
So those of you who don't know, Sooner Care kind of broke up. I'm gonna guess everybody knows that. And so Humana is one, Oklahoma Complete. And so you pick Aetna, you pick your provider, and I'm gonna say each of them have some unique and special things that they can offer the clients. But it is a learning curve
Right.
to figure out which one you're on and what they offer when you're hearing about different things.
And they can call the community health worker, which is what I am at the health department. and we can go in and look at their senior care case, and we can let them know which, plan they have and how to access the extra value benefits associated with that plan, whether it be rental assistance, utility assistance, diaper assistance, whatever they may need. And the community health worker is in every health department.
Nice.
You're a blessing. I'm working closely with our case managers, social workers, and discharge therapists in the hospitals as well. Let me give you my card too. Because there are educators as well, because they come across a lot of our members. And, I'm trying to revamp SSN's, their resource book, because the resources are only for people in one area. You have a person traveling from out to Oklahoma City, and you give them a resource book that only has Oklahoma City resources, and that's not very helpful, right? So as a liaison for the Southwest region, I'm gonna make one and list those resources.
So I'm gonna challenge you.
Okay,
I hope you're okay with that. I feel like we're friends now.
we're friends.
Have feel like we're friends and there we go. Look at Oklahoma Healthcare Authority's Find Help. Find Help. And you can just search Oklahoma Find Help. It is an online electronic resource. And if there's an organization serving a local community that's not on there, they can get on there for free.
Mhm.
And if they're missing something, the organization, so like there's a local food pantry. They can go and claim their profile. It's already been loaded up. They can add their hours, or if they're gonna do some special event. But it is a statewide resource that Oklahoma Healthcare Authority has made available to us for free. And so it's an electronic form, but you can go in and you can put in different criteria. And I think it's a really neat platform that several state agencies are looking at using. So to have something cohesive as a possibility,
Okay,
if just another idea.
okay, well, thank
Okay.
you.
Don't forget to check out our website. We do post information there. We have events. We have highlights of stories. But it is oklahoma.gov/faith and community. Okay, so I am gonna wrap up my portion. And if you have a phone and you want to take a picture of this will give me and Delby your information and any ideas that you have for connection, or if I said I'm gonna send you something and you're worried about my memory, and you should all be worried about my memory. You're gonna make sure that you put it in here and it's gonna have your contact information, so I have it. I tease everyone, I've stopped dyeing my hair, I don't know if you can tell.
It's pretty.
I say it, I worked really, really hard for these. I've parented over 21 children to get these. And that means that my memory has gone from fantastic to so-so.
I'm right there with you.
Right.
I'd say no more. Just letting it go.
So if you send me some information, how you want to connect, then Debbie and I will have that info, and then of course your contact information as well. Okay, so that's a little bit of an overview of Office of Faith Based, and so now we want to take that next step and dive in. What does that actually look like with our pilot that we've done with the health department? And so Delby, I'll let you come introduce yourself and take off on our next section. Did everybody get the QR code if I change it? Okay. Well, you might just give them a second while they're. Yes.
The opportunities, employment opportunities in your department, in your agency, or are there any?
The Office of Faith Based, we are only 2 people and they don't plan on expanding.
Okay.
So unfortunately, there's not any there. When we look at the other agencies, we have Office of Juvenile Affairs that has some open vacancies. Department of Human Services. They haven't refilled some of their positions lately, unless it's some of the frontline workers. But there might be some stuff there.
You said
Told us we
juvenile-
were behind.
juvenile affairs, what else?
Office of Juvenile Affairs, Department of Corrections. We were actually helping them not too long ago. They were looking for a new, what's that word? Chaplain, for a couple of places.
Okay, so that's with Carol and. So we're with her,
Leo Brown.
Leo Brown, okay. Okay, thank you.
You're a wealth of knowledge, aren't you? So I'll introduce myself to you. I'm Delby Walker. I've been with the State Department of Health 20 years, and I have had an array of positions during that time all over the state. And I have recently transferred. I started out working under the state as a regional coordinator for a youth program we had, and then went from there to doing academic detailing on tobacco cessation, and then was a regional director over 5 county health departments, and then transferred back home to Muskogee and in community engagement. 3 years ago, I transferred back to the state office, and I am the state's community engagement and health planning coordinator. So I have absolutely the joy of collaborating with people all over the state. And Andrea is one of my favorite humans, as she has a heart for Christ and a heart for the community. So we are very like-minded. This pilot that I serve as the liaison, as she stated, for the State Department of Health with the Office of Faith-Based Community Initiatives. And so I am able to go to our bi-monthly meetings and kind of report out the collaborations that we have across the state. I get to brag on you ladies that are doing great work for the State Department of Health. And any partnerships you have with churches, I'm able to share that with them. And she posts it on her website or it goes in her newsletter. So you ladies keep sending me pictures, any write-ups of things, collaborations you're doing with churches or faith-based organizations. And with that being said, I'll share with you kind of what the way I am is I take an idea and I just, let's go get it. I'm not one that, as she was talking in earlier, are you a 95 or 85? I'm a 50%. Let me do the pros and cons. Let me see how I can do it and let's go. I'm one of those that likes to get it done. So with the Muskogee County Faith-Based Community of Practice pilots, we have started first of the year, and there are 2 networks. One has 20 churches and one has 40 churches that their leadership attends. The meetings have had between 24 and 30 people attend at different times. We rotate meetings. We've done in person. We also have done virtually. The awesome thing about it is there are nonprofits that attend. There's a business owner, a couple business owners actually that attend. And then in June, we had a tour of Fostering Hope, which is amazing agency. She has different agencies throughout the state. I wasn't aware of that until recently when we toured her site. And so I'm going to share a little bit about what we've done. So we started off with Scott Comer from 1440 Promise, which he has a prison ministry, and was able to connect some of those pastors to him. They messaged separately and talked about collaborating. And we shined on District 7 for the State Department of Health, their community engagement team, what they're doing to partner with local ministries and what resources they had available for those that were online. And then Andrea shared kind of her role. In person, we've had OKDHS. They came in and taught the pastors how to, in their some are just lay members that come, how to recognize signs to report child abuse. Many, work in the children's ministry, and they see things, and you kind of want to, do I report this? Who do I report it to? And so it was really awesome to have them come in and share with us what some things are to kind of look for, but then also who do you report it to? And then Hunger Free Oklahoma came and talked about their summer program, also had some grants available and sites for them to know in the area of where to go, have the children go to get food during the summer. So it was really great to see their map and to find out what's available for the churches and also how they could apply for some grants. And just so you guys know, every year they have grants open. So in your area, that's a group to reach to find out maybe your church wants to be a feeding site, or a local nonprofit would like to be a feeding site for your area. And then Tammy Williams came in from Department of Human Services, and did Science of Hope. And it was so cool. She only did a smidget of it. I don't know if you're familiar with it, but she's absolutely amazing. And now Andrea is trained that she can do it as well, but it really does help them to kind of see that, oh, there's science to support what we stand on. And then fostering hope, as I was talking to you earlier, I have a photo to share with you about this. Down here in the middle is Annie. Sorry. She was actually my daughter's kindergarten teacher. This is her brainchild. What they do is within 24 hours, they call and alert them that there's a child been taken and they need a place to go. Her facility is a safe haven that they wait for someone to come and get the child. But they have tubs, and they have actually 4 buildings, one with fall and winter, one with summer and spring, another with books and different things. And every child gets a bag that goes with them with items, with clothes and different items that are donated to them. That also has books. And then they also do a little birthday party for the children. And it's just beautiful, the work that she does. And as I said, they're in all different counties throughout the state. If you'll go on her site, you're able to see if they're in your area. And one beautiful thing about her is that she does love the Lord. And so has ladies that volunteer to rock babies and just do all kinds of things. And also churches were able to hear how they could donate items to be a blessing to those foster children. And that's Tammy. One of the things that, I don't know if you heard Dr. Cutler present yesterday, he and Jeremy, but we had a youth leadership summit in Muskogee. As I was stating to Jennifer earlier, I was a project manager for it. And so I was able to collaborate with churches, and we had 1,100 seniors that came in. Well, for one day, and Tim Tebow and some other neurosurgeon, football player and neurosurgeon was able to come in and speak to the young people. But we had the churches that collaborated, and they donated $1,500. I think it was $1,800 for us to give away $100 scholarships with gift cards to the seniors. So they pulled and they received $100, and you would have thought it was $1 million. They jumped up screaming and yelling and running. And so for one said it was going to be gas money for the month, and another was going to help them pass some food. So it was just a beautiful thing for the churches to come in and say, hey, we want to be a part of this, and to give. And like I said, we were right at $1,800 of donations. But my network of pastors that I've been collaborating with the pilot were the ones that came in and said, here, let us help in some kind of way. And then this was a photo of the our very first meeting. The other ones didn't want to be in the photo, but my sweet daddy was a pastor, and he just recently passed. And then a photo of us at Annie's site. So I'm thankful to my dad, who was able to connect me with quite a few of the connections with the pastors. And so we have 35 partners, and as I stated earlier, the 2 alliances of 60 churches. And then as I stated, or I shared this with Annie, you were telling me about it, but I did get this right. There was a lady that attended that does the free assistance with adoption. There was a way she didn't know anything about what you shared with me about. There was a service to help them get it free. She knew nothing about it. But Annie's been trying to get in touch with the pastors for years, and been trying to get connected to churches. And so once we collaborated together, the first time in years that she was able to have them right there and to be able to present to them and try to get them to donate. And then so our next steps is Andrea and I are going to McCurtain County. If we can get on their schedule. I got a call this week that she's trying to make sure that we can get in, but our schedules are kind of nasty for October, so we're hoping that we can make it work. But we're going to go down there and just see how we can collaborate with the pastors down there. Also, I am starting a class that if you've heard of it, within my reach, is for individuals about decision-making and relationship skills, life skills. We'll start that on October 16th. And so I am presenting it to the churches that are in this group that we collaborate with to try to see if we can get 25 attendees. It's one of the best trainings that I've had gone through. And so I'm like, okay, these skills a lot of people need. A lot of people are struggling with their decision making. They're making wrong decisions. And so it's an opportunity to take the training to them. And so that group will be the group that I focus on, will be those churches as I share it with. And it'll be a 5-week class. Also, I provide resources for churches on all different kind of health issues. The lady reached to me that's a nurse, retired nurse, and she trains at different churches. Recently, with September being fall prevention, and I was able to give her materials on fall prevention. And so whenever they reach to me, they're like, hey, can you get me something on cancer prevention? Can you get me something on healthy brain? I'm able to try to get resources to them. And so I'm connecting the dots for them, whatever they need. I try to bring in those resources to educate them. My hope is, I'm sending out an evaluation, but my hope is that we'll probably go to quarterly, and I'll be able to do a day where they get nonstop training from different resources that are available for them. And we'll be able to have some of their members come as well if we do it on the right day. And so let us know how we can partner. She had you sign the QR code, take a few photos of the events if you are collaborating with churches and you have a really nice event. And I believe my email is on here for you to send it to us and let us know so that I can brag on you. And then I do like to hear, I think we have a few minutes, any ideas that you are like, hey, I would love to see this happen with a collaboration. Share it with us, and so that we can kind of see if we can make it happen. I had a lady stop me in the hallway and said, it would be great if you could connect some different resources for prevention, is what she was sharing. And I'm like, well, that's an easy source to bring some resources, set up a day or some time to come and bring chronic disease and cancer prevention and different other groups to you. That's what I do. So if you'd like for me to collaborate with Melissa Sims or Victoria Cleveland to bring in your area, for sure, let us know.
And since October is Breast Cancer Awareness Month, if anybody needs information on that, feel free to reach out. I'm happy to come speak or send some of my staff. And when we come, we don't just bring cancer stuff. We bring all of chronic disease information. So healthy brain, diabetes, heart health, just anything that any of the programs that we have in chronic disease prevention, we bring anytime any of us go out. So we've got speakers that focus in on specific things like healthy brain. We've got a gentleman that goes all over and they can do some memory screening and all kinds of stuff. So if you have any questions, you can just shoot them to Delby. I forgot to grab some of my business cards, but she works with me, so she can get that information to me and we can get
And
something
then,
set up.
that QR code that you filled out with for Andrea, just let us know and I'll make sure I can connect you this. Any questions? Now will be when we take your questions.
I'd be interested to find out if more information about the how you work with ministers there in Muskogee, because we've been trying to do that diligently around the state with the different coalitions, county coalitions. So I'd like to get more information on that. I think you'll find here in this area, you have some very unique ministries here. For instance, in Hobart, they have a new pastor there at the Methodist Church. And what he did, he started a ministry where he would go to the washateria and they would wash people's clothes for him. And the other churches joined in. So that's a big thing now. So the ministerial alliance is back in place there. But
That's who we collaborate with. One of the groups is the Minister Alliance. and then the other is the Christian Ministers Union.
Right, I'd just be interested in how, well, this one in Muskogee, how that could fit in with other,
For sure, it can be duplicated.
right,
One thing we do is that we have those meetings where we bring resources to them, and the resources are things that they've asked for.
okay,
And so, they are more willing to come if it's something that they want to hear about. The Christian Ministers Union has a conference or something coming up, October 25th, and they've asked me to connect them with someone to do the brain training. So I'm bringing, the gentleman she's talking about, Jacob, and to do an hour
where's they gonna
training.
be?
That's gonna be in Muskogee.
Let's go, okay,
So it's just whatever they ask for is I try to bring to them.
okay.
They're more likely to participate if you get them something that they want to hear about. I haven't set the next meeting for us to have for the fall. We'll get with Andrew. We may actually probably do November 1st since our October, both our Octobers are rough. Maybe the first week in November if we'd like to come to that one.
Okay, I'd be interested, yes.
Yes, sir. Andrew will have your information and we'll make sure to shoot you an email.
Okay, thank you.
That you can come and see it.
And anytime that you guys need as a liaison for Humana, please don't hesitate. I'll come and table. You need volunteers. I also, and I really want to connect as far as the disaster relief. Like we tried to figure out like where to go to set up. Cause Humana would say, I was like, hey, we need baby wipes, or they say there's a need of whatever, and we're able to get that mask, show up. So if there's any way that they can put me like on a contact, list, like if,
So what we did for emergency management, and I had no idea. I got invited when the wildfires were happening, and it was like a news conference room, and there were people there, and so I represented community and faith-based organization. And then as soon as something would come up, it looked like the fire was hitting here, who has connections here. And then we put together. I was like, was that our 5-minute warning?
I'll give it to you. I got it.
We went over, stop. With emergency management system, we actually devoted a place on their website, and it says updates, and it had like the dates and what we were facing. And so as I found out that this church had food, or this church had this, or this community, we listed it all. And so it was one place with all the local organizations, who was serving and who needed what. And so even if I put out something on social media about what a need was, it went back to this list that emergency management kept on their website. I'll make sure you sent me your information. Yes, I saw it. That I send you that website, but that's where we kept it all consolidated. So each county had one. We had our point person. It's who we hooked up with FEMA. It was really, really nice that we were able to consolidate.
Yes, I want to be a part of that. We did some things last year, but it was like me calling 50,000 people to figure out what the need was. So if they said, I know we were in like Guthrie, I think it was some fires out there, and they were like, babies need baby wipes. So we bought had all these baby wipes. We then came out, and our value added benefits, if they're a Humana person, there was some of those things in there that could help assist them as well. So just to be able to give it more and just be more hands on deck, like whatever you need us to do, like we're there. So just an easier process for me to say, hey, we got this, let's move, what we need to do, like, give me the card.
I know, I feel like I'm where I can go. I enjoy the desk.
Yes, I love community work. I love it. To see it's like Christmas when you are able to be a blessing to somebody,
The State Department also has, it's slipping me, the volunteers that go and they can discharge them whenever there's an emergency.
MRC volunteers.
Yes.
I'm in MRC.
Okay, you're in Marcy.
Already
Already connected.
Yes, do in Oklahoma City, the mobile market, which I've been trying to see if we can
Mm.
do something like
So
that
are you
here.
out of Oklahoma City?
Yes.
Okay, okay. That is all I have. My email, if you want my email, it's just my name, it's DELBIE. It's delby@health.ok.gov.
So we have about 5 minutes left. We're at the end of the survey. Please take a moment and fill that out. Let us know if this was helpful. If we missed something, what you'd like to see. Anything else that we can help you with while we're here?